The unique advantages of experiencing sex hormone treatment with sex hormone optimization therapy as a component of health optimization therapy.
In patients with sex hormone insufficiencies, halting your downward spiral and replacing it with an upward spiral of health involves initiating treatment with sex hormone optimization therapy, or S.H.O.T, the core therapy of health optimization therapy. The significance of S.H.O.T within our comprehensive treatment package is based on current scientific evidence that indicates, first, sex hormones have health-promoting effects on a wide variety of tissues and organ systems across the vital components of optimal health. And secondly, that suboptimal sex hormone physiology is one of the most common sources of suboptimal health. Let's take a look at the differences between sex hormone treatment at a typical gynecologist's office, hormone clinic, men's clinic, or med spa, and the thorough and comprehensive care you'll receive at DTRC. Here's what a typical treatment provider offers their patients. First, minimal clinical and laboratory initial evaluation that's limited to diagnosing sex hormone deficiencies such as menopause in women or hypogonadism in men, without considering other potential factors impacting the patient's health. They focus on severe hormone deficiencies rather than suboptimal sex hormone levels and syndromes related to sex hormone behavior, and treat only men or only women, and usually not both. Secondly, an extremely limited treatment plan targeting a minority of issues contributing to your health concerns. Minimal, if any, reevaluation throughout your treatment plan to assess its safety and effectiveness, and non-physician staff such as nurses or nurse practitioners overseeing the process of diagnosing, prescribing, and reevaluating treatment. Now let's compare that approach to receiving sex hormone optimization therapy as a component of DTRC's health optimization therapy. Here's what you can expect at DTRC. First, an initial comprehensive clinical, laboratory, and diagnostic testing to identify the following: the full spectrum of symptoms and conditions influenced by sex hormones within the 5 vital components of optimal health, across the age spectrum, in both sexes, and including those conditions related to suboptimal hormone levels and hormone behavior. All other common medical conditions that could contribute to your health concerns, as well as identifying the potential risks of sex hormone treatment. Secondly, thorough clinical and laboratory reevaluation to assess the safety and effectiveness of ongoing treatment. Thirdly, physicians overseeing the process of diagnosing, prescribing, and reevaluating treatment. Fourthly, sex hormone treatment designed and modified to optimally improve all identified symptoms influenced by sex hormone insufficiencies. Fifthly, a multiplicity of sex hormone options, including implantable subcutaneous pellets. Sixthly, a vast array of non-sex hormone treatments that support and work synergistically with S.H.O.T to target all of the issues contributing to your health concerns. If you're someone that places a premium on experiencing life to the fullest, it's time for you to start your journey with DTRC's health optimization therapy, the total package for achieving optimal health on the path to becoming the optimal version of yourself.